What's up, guys? Welcome back to my channel. So today we are talking progress notes, SOAP notes, HMP notes, everything that you need to know how to write a good note as a nurse practitioner student and also as a new nurse practitioner. There's a million and one ways of writing a progress note. You just want to make sure that everything is in the progress note that is supposed to be in there, so that the next person that is reading it can have some kind of clear picture of what actually happened with the patient. So let's get straight into this video. The acronym right here, if you don't know what it stands for, so S is for subjective data, the O is for your objective data, and then the A is assessment, and the P is for plan. All right, guys, so this is what my history and physical note would look like, and I went ahead and I just put this right here. This is for educational purposes, of course, so let me highlight that. History and physical basically is your initial clinical evaluation and your examination of your patient. So your history and physical is going to contain what's called an HPI, and the HPI is history of presenting illness. Now once you see the patient again, you would not put HPI there, you would put S for subjective data, because it is not the initial time that you're seeing the patient. So right here, self-explanatory, I like to formulate mine like this, and then right here definitely goes down into the area of your objective data. So this is pretty much all objective data right here. Even your physical exam, all of this is objective data. Now past medical history, social history, I went ahead and I wrote reviewed and edited where appropriate. You can say that. I typically list the medications that the patient is on. I will show you in the other example when I move on to that. So you can do either or. You can list all the medication, or you can just write it out like that. Now, review of system. I'm going to tell you guys this. If you are a nurse practitioner and you are working with a physician and you're working in a long-term care setting, you are not allowed to technically write a HMP note. You can write what is termed initial progress note, because that is the initial time you were seeing the patient. The only difference between the initial progress note pretty much is really a HMP, but you're gonna take out the review of system, and I'm telling you, it's per Medicaid or Medicaid guidelines that the nurse practitioners are not allowed to write the HMP note. So the review of system, if you just take the review of system part out of it and leave everything else intact, you're following the rules, you're following guidelines, and now you're also protecting yourself and your license. And then down here of the rest of the objective data, the physical exam part of your documentation is now what you physically assessed on your patient. Of course, I just kind of went in and fill in some of these things just to show you guys an example. No acute distress, patient somnolent but alert, or the patient is awake and alert oriented. If the patient looks frail, if the patient looks disheveled, you can definitely say whatever it is you want to say in this general area. And then the rest of it, the lungs, the cardiovascular system, musculoskeletal, all of that. So this is pretty much a template that I just have on my computer that I follow when I do my documentations on patient. And of course, A and P is the assessment and plan. Now I'm going to jump and show you guys a full formulated initial progress note on a patient. All right, guys, so I made this entire progress note up just for demonstration purposes. So as you can tell, it's titled initial progress note because technically I'm not really supposed to be writing the HMP note. So it says initial progress note and the patient's name, date of admission, when the patient was admitted to my facility, date I saw the patient's date of birth, and the patient's room number. Remember, I said when you're initially seeing a patient, you would put HPI, history of presented illness. Now this is where you put all of the data that happened, why the patient went to the hospital, what happened when the patient was in the hospital. You want to make this part as detailed as you can. So as you can see from here, I put 78-year-old African American female admitted from St. Peter's Hospital where she presented, and I tend to put the date when the patient first went to the hospital from home after she sustained a fall. Now, I like to put details in this part so that if somebody else is reading this and they're not, say, the primary care team and they don't really know the patient, they can read this and see what is really going on with the patient. The psych people, the social worker people, a lot of different people read these notes, and you want to have more information in it that makes sense to what's going on with the patient. So since the patient fell at home, I like to put the test that was conducted when the patient went to the hospital, and I also like to put pertinent lab. If the labs were either critically high or critically low, I like to list it. So for here, as you can see by the highlighted part, I put that in the ED. X-ray of the hip was done and it did show a fracture, and then a CT scan was done and confirmed that the patient did have a right intertrochanteric fracture. Then I put what kind of labs were significant for this patient when she was in ED. Her sodium was 125, her potassium was only 3.0, and I list what the troponin was. Then I said the repeated troponin, EKG was done. I went on to also say the patient was assessed by ortho. She had a ORIF done, and I put the date when the surgery was done. Also, if anything happened while the patient was in the hospital other than what she went for, anything that happened that complicated the patient's stay, you really want to go ahead and highlight that and say that. So for here, I said that hospital stay was complicated because the patient subsequently actually went into AFib with RVR. She was cardioverted and started on digoxin, and then she actually converted back to normal sinus rhythm. And then I go on to say that the patient was transferred to this facility for rehabilitation. Now, this is what I'm seeing right now when I'm assessing her. Upon assessment, patient still laying in bed, still complaining of pain to right hip, but she state that she just finished physical therapy. She denies chest pain, shortness of breath, no fever, no chills, none of that. Then you go on to the next part of the note. Remember when I was telling you guys that I tend to list out the medication that the patient is on? This is what I do right here. I just list out all the meds. You don't have to list it out. I just list out all the meds that the patient is on. Past medical history, past surgical history. This is where you will typically write that. And like I said, all of this data right here now is going to be your objective data, your past medical history, your past surgical history, family history, social history, all of this. And now you come on to your physical exam of the patient. So your physical exam is this part, and it's pretty much the same thing that I just showed you guys, but I put it in a different format and just kind of compact it a little bit more, if you will. Like I said, guys, I took out the review of system out of this because technically I am not supposed to be doing the HMP note, but I can do an initial progress note on the patient. So that's why you realize that there's no review of system in this note. This is my assessment and my plan. You can either write one, this would be one assessment, and then you could put the plan directly underneath it, or you can just list each one stack just in this format. And I tend to just list them like this, and then underneath the bottom I go ahead and I list what the plan is. So you can do it either way. Say for instance you list that. We can put this would be the plan for this. So either or. So the first thing, as you can see, is the initial thing that the patient went to the hospital for. It says right intertrochanteric fracture, secondary to fall, status post, ORIF. And the plan is PTOT. She's going to follow up with ortho surgery in 2 weeks, and also pain medication as needed. So this is my plan for this. Then for the new onset AFib with RVR, status post cardioversion, my plan for that is we're monitoring her heart rate, notified MD of any changes, going to follow up with cardiology in 2 weeks. So this is pretty much how you make your note flow and concise as much as possible. And then I also go on to say pain management is going to be per Dr. West or whoever the pain management doctor is in the facility that you work for. I also put we'll check her labs next lab day. All of these other things, she was hypokalemic in the hospital, hyponatremia. I am saying that we're going to recheck these labs because these things were already resolved when she was in the hospital, but we are going to continue to check her labs and monitor those things. We're going to be monitoring her overall status, her vital signs, her clinical status. We're going to monitor her bladder, skin. I talk about that her blood pressure was stable when she comes in. And I tend to, for myself and my patients who are just coming from the hospital, I tend to highlight what the last set of labs were when they were in the hospital, because it kind of gives me a base. So when I draw labs while they're in this facility, I can kind of compare what the labs kind of was when they were being discharged from the hospital compared to what the labs are right now in the facility. The next thing you do as a mid-level provider, nurse practitioner, you have to put some kind of a note at the bottom of your progress note saying that you discussed it with your collaborating physician. So you could say discuss it with Dr. Davis, discuss it with Dr. P. History and physical was done in collaboration with Dr. P, and he agrees with my assessment and my plan. And then of course you go ahead and you sign your name at the bottom. That is it, guys. That is how I typically formulate my progress notes when the patient comes in to the long-term care facility from the hospital. I hope this video did help you a little bit or a lot, and let me know in the comments if you have any further questions about this. For all my new NPs who are going to be working in a long-term care facility, don't let your boss pressure you to write these HMP notes, because you're not allowed to write these HMP notes. I'm gonna look up though if it's only Michigan, but it's Medicare, Medicaid guidelines. Like, you're not allowed to write the HMP note as a nurse practitioner. Please, it's your license at the end of the day. Thank you guys again so much for watching, and don't forget to like, comment, and subscribe. Bye guys.